Okay, our next subject is the sponge tub or shower bath. It's personal skill number 3, and our objective is assist the client in shower or with a sponge or tub bath, encouraging self-care as much as possible, which means we want our patient to be as independent as possible for as long as possible. And sometimes that means letting them take a little bit of additional time. Might take them 10 minutes to do it, even though you could do it in 5. It's better for you to let them take the 10 minutes to do it. It's better for them in the long run. Okay, number 1. Assist the client to the bathroom or positions at bedside for a sponge bath, and we're going to have it set up right now to position at bedside for sponge bath. And number 2, we're going to assist the client to remove their clothes. Remember, when you're gathering up, if a person has a full top on that doesn't button up the front, you want to gather it up, pull one arm out, pull the other arm out, and then you want to bring it up over their head. Try not to rip their nose off when you're doing that. Number 3, uses the water at a safe and comfortably warm temperature. You want to make sure you're checking the water on the inside of your forearm. That's the most accurate place. If it doesn't burn you, it's not going to burn them. Number 4, if there's a shower or tub bath, assist the client into the shower or tub. One of the things that I have here in class that I'll show you is the extended tub chair. The extended tub chair works very well with patients that have enough room in their bathroom, because they can sit down on the outside of the tub. Out here, you can help them get their feet in, and then they can just slide over into the tub where the shower head's hitting them. It's very safe to use. It has sturdy rubber bottoms on it as well. When they go to get out, it's real nice, and it's nice and wide. It helps a lot, especially when they can't get from a position on the floor to a standing type position. They don't want you lugging and pulling on them and hurting something in your back or dropping them back down into the tub. Number 5, washes the patient's body parts that the patient cannot wash, using soap and water on the face first, then the upper body, and then after changing the water, if you're using a sponge bath, then you do the lower body. There's a couple things in that sentence right there that's really important. The first thing is, only wash the things the patient can't wash. And my wife and I always say, look, if the patient can feed themselves, they can wash their groin area. Because a lot of the older men, they try to get you to just wash their groin for them. Well, I think you better wash it again. You washed it once, wash it 3 times. No, that's not how we work. And if that ever happens, you need to bring that to our attention.
You're okay.
We're taping. Number 5 also states that you want to wash the face first, then the upper body. And that's extremely important because you're going from the cleanest area to the dirtiest area. You know, if you're going to wash a car, you're going to start on top and wash the top, and then you're going to wash the sides, and then you're going to wash the tires on the bottom. Same thing with an adult. You don't want to wash their bottom first and then go and wash their face, because you're taking that bacteria from the bottom and you're putting it in their face. Don't do that. Next, you're going to protect the client from unnecessary exposure. And how do you do that? Keep them draped. So, if you use 2 or 3 towels during your bath, that's fine. That's not a problem. As they're sitting up here, we're going to put this one over your lap. You can put your hands up on top of it. We have another one that we can put around their shoulders. And like I had mentioned earlier, you want to go ahead and you want to turn the heat up a little bit, a couple degrees in the house, maybe just 2 degrees. That'll get that furnace on. Wait about 10 minutes. You'll get some heat coming in. That's going to help prevent that chilling effect that the water, as it evaporates off of your body. Okay, so we're protecting her from unnecessary exposure and chilling. Number 7, we've used the washcloth, we've used the soapy water. We've got in between the fingers good. You want to check the fingernails, make sure that those are clean. Get in the skin folds underneath the arms. Make sure that if it's a female patient, that you're lifting up the breast, that you're washing good underneath the breast. Make sure that it gets rinsed well. Make sure that you pat it dry well. You don't want to rub it too vigorously because you're going to tear that top layer of skin off. Some of the older ladies like to take the washcloth and place it underneath of the breast, and that allows for it to stay dry and allows for some air to circulate underneath of there. You have to keep in mind that the skin folds, even the abdominal skin folds, if someone has an obesity issue, you have to lift those skin folds up to get in there good too, because it's dark, it's moist, it's warm, and that's where the fungus will grow in that type of an environment. And if you notice any redness there, any drainage, maybe a rash, you need to go ahead and call the office because we need to get that taken care of quickly. Number 8, you're going to gently apply lotion to the skin after we dry the skin surfaces. Number 7, you want to pat dry. Again, you don't want to rub too vigorously. We would use a different towel for that if we had to get the feet. And it's a good time for you to, communicate with your patient. Let them know what you're doing. Ask them how they're doing. You can learn rather quickly if they're having any problems. You've been having any pains anywhere last night or today? How's your breathing today? How's the appetite been? What did you eat last night? Those kind of questions. Number 8, gently applies the lotion to the skin, special attention to dry and bony areas. Observes for redness or discolored areas. Now is the best time to put lotion on. We've got her skin moist. Even though we've dried it, there's still moisture on that skin. You want to put the lotion on right now. It locks it in. The dry areas you want to pay attention to is the back of the elbows, the hands, the knees, and the heels. You want to make sure you get lotion on those areas. You also want to go ahead and put some lotion on their back, and there's a whole section in here about back rub. But don't forget that area. We'll cover those steps when we get to that. Number 9, assist the patient to put on their clothes following a bath. Again, allow them to do what they can do when trying to put those clothes on. I've had some patients and family members that will cut their shirts up the back all the way up the back. They'll cut it. That way when the patient's in bed, they just put their arms through like a hospital gown, and then they lay down, and then they still have a collared shirt on or a dress shirt. And it looks a lot nicer than the hospital gowns. But we're not permitted to cut those, not without the patient and family's permission. Number 10, assist the client out of the bathroom or repositions them in bed. And we're going to go over repositioning in a later skill. Okay, the next topic we're going to cover is 4A, how to shampoo a patient's hair while they are in bed. First one says the step is that we need to position the client with their head and shoulders moved toward the edge or toward the head of the bed. So we would actually take the patient, we would bring him over just a little bit closer to us. If we have a draw sheet, we're going to use a draw sheet to help bring them over. Because you don't want to be stretching all the way over here, you're going to get some low back pains. And I've already raised the surface of the bed to a height that I don't have to bend over to work. Not much. That's going to reduce the wear and tear on your back. Okay, number 2, removes or protects clothing that may become wet during shampoo. So we've got one towel underneath. We could take another towel like this. Go ahead and raise your head up a little bit. And we can bring it down and protect your clothing. But you want to do this before you change the bed. If you change the bed and then decide you're going to wash your hair, guess what? You're probably going to have to change the bed again when you're done. Even though you take all the necessary steps and precautions It's almost impossible to not get the sheets wet. So we've got that protected. Number 2 is good. Number 3, you're going to place a plastic or improvised water trough under the client's head so that water constantly drains away from the patient. There are shampoo pillows that are available. Unfortunately, right now I don't have one of those. They're like a little kiddie pool, and they will blow up around the patient's head. It's a little bit higher all the way around except for where the neck lays back into the inflatable plastic trough. In this corner toward me, there's a small little hole with a tube attached, and you can put that right down into a bucket of any kind. But if you don't have one of those, call the office, let us know. We'll try to work on getting one of those in the home for you. But in the meantime, you can use a black garbage bag and a towel that's rolled up long ways. And I've already done that. What you do is you take it like a U, and you bring the towel together. The open ends are going to stay towards you. You're going to place this in the black garbage bag, and you're going to open it up into a U. So we're making a trough. We're going to place this under the patient's head. I have a good patient. She helps me. We're going to place that under her head, and we're going to allow her to lay her head back. Now we have a trough. The water is not going to go up over top of this and onto the sheets. It's going to flow this direction. And over here, we would need to put maybe a couple of the blue pads turned the other direction. I know they're here somewhere. Or we put the 5-gallon Ziploc bag here. Take a couple of these blue pads, and instead of putting the absorbent side up, put the plastic side up. That'll also help protect this side of the bed. Under the bucket, I would probably take a couple of these or a towel and place that in case the water goes out of the bucket onto the floor. You don't want to be falling while you're trying to work here with your patient. Number 4, use water at a safe and comfortable warm temperature. Okay, we've already checked it on our arm. We have a small cup of any kind will work that we can dip into our water, bring it over. We can pour it onto the patient's head. You want to get it wet first. You want to get your shampoo and lather it up nicely. Then you want to go ahead and dip your cup in, and you're going to rinse it. Then you'll take an extra towel. Once that it's rinsed thoroughly, and we're going to gently pat it dry. After that, you're going to comb the client's hair, number 7. And number 8, we are protecting the patient from exposure and chilling as well. If they're able to get up to use the hair dryer, maybe into the wheelchair, that's fine. If they stay in bed, you can take the hair dryer and you can put it on a lower type setting, and you can dry their hair while they're in this position. You can have them roll over on their side, and you can dry the back of their hair. Okay, our next skill is shampooing at a sink, tub, or the tub, and our objective is to assist the client with shampooing their hair at the sink or in the tub. The performance behaviors for this, there's 8 steps listed. The first step is to remove or protect the client's clothes that may become wet during shampoo, and we have it set up right here that the sink is actually in front of us. This patient, since I don't have a wheelchair here, we got a makeshift wheelchair here, and we're going to use the walker. Still someone that can get around a little bit with some assistance. So there's one of 2 ways. If the sink's low enough, and we can back a wheelchair up to it, we can allow them to lay their hair back, and we can, or their head back, and we can wash their hair that way with the sink there. We could put a plastic bag of some kind to assist the water to run away from the patient's head into the sink. If not, you can find one of these. It's a plastic trough that attaches to a patient's head. I don't know how far this will stretch, buddy. I want to find out. We'll put it around the patient's head, and it velcros to their forehead here together. And that helps keep the water away from the patient, and there's a hole at the bottom. You would put this in the back of the sink, and you would allow the water to run down into the sink away from the patient. They can't have too big of a head to use this thing, though. It's pretty small. They might come in different sizes.
Yes, they have to be tight, you know.
It has to be tight so the water doesn't run down in the eye. That's another example. We've got the towel here. We've got an extra towel. I would set that right beside on the countertop where you can reach it easily. Say the patient is short of breath, you know, they can do some activities. What we'll do is we'll have the patient stand at the sink. They can even hold on to the sink if they don't use a walker. They can lean forward. A lot of the sinks have the little sprayer that you can bring out and you could spray as their heads lean forward. Or you can use the cup to pour on the hair as well. We're going to lock the wheelchair brakes if we're using a wheelchair, and we're going to ask the patient to stand. Will you please stand? So you're a good patient, no matter what they say about you. Number 2, positions the client in a comfortable position. Patient's comfortable, we're at the sink. The sink's in front of us. Number 3, uses water safe and comfortably warm temperature. We've already got the water on, it's adjusted. We've got the shampoo sitting beside us. Number 4, assist the client to wash hair using the shampoo and water. Allow them to lean forward, wet their hair, okay? Get some of the excess of water off. If it's a person that can stand there the whole time, let them stand. If not, allow them to sit back down. Go ahead and put your hand back and grab onto the arm of the wheelchair and have a seat. The wheelchair brakes are locked so that it doesn't kick out from behind you. That's very important. Now that the patient's hair is damp, we can put about almost a quarter size amount of shampoo in our hand. You want to rub it together. Then you want to go ahead and massage it through the patient's hair. You want to use your fingertips vigorously to clean the patient's hair. We're getting all that oil that's in there that's built up out of it. Once the hair is shampooed, we rinse our hands real quick, the shampoo off. We ask them to stand again at the sink. Let's go ahead and stand. We have them lean forward. If we have the sprayer, we spray it. If we have the cup, we use the cup. Take some of the excess of water off. At this time, we could take the towel, help them dry it. If they can't stand for a long period of time, just place the towel there, allow them to sit, and then dry their hair at that point in time. If we had to take the shirt off, we would at that point in time assist them to put the shirt back on. And then we would protect the client from exposures and chilling by, again, using the towels. They could have their pants on at this point in time. If they don't, you want to make sure that you put a towel over their lap. Bring your hands out. There you go. That'll help keep their lap nice and warm. Our next skill is nail care. And there are 5 steps to give not just toenail care, but fingernail care. Noting that if there's any rough edges on the nails or any skin breaks or irritations, one thing I want to let you know is that we're not allowed to cut toenails at all. Never. That's the podiatrists that handle cutting the toenails. That's the first thing. Second thing I want you to know is if a patient is ever on blood thinners, like aspirin or Coumadin or Motrin, where it says on the plan of care, clean, foul, trim, where it says trim, I cross it out and I put no. That way you know we're not allowed to cut their fingernails. They could bleed profusely. We don't want that. Number 1, you're going to soak the client's hands or feet in warm water for 2 to 3 minutes. So we would have a basin where we could just let them put their hand in. If they have an over-the-bed tray, bring it in front. You can put both hands in at one time. What that does is that softens the nail. If you were to try to trim someone's nails, you can clean them whenever they're hard. But if you try to trim them when they're hard, when you cut in, it'll actually, the crack will shoot backwards up into where the live skin is. You don't want that. They're brittle. They're already dry. Most of the older people we take care of, they don't drink the recommended 6 to 8 glasses of water a day anyway. They're only drinking 1 glass of water a day. So they don't have enough moisture. This is going to help with that. How long? 2 to 3 minutes. Number 2, we bring the hand up out of the water, grab our washcloths. They're back there. Okay, anyway, we would take some soap and water. We would clean the nails. They have what's called an orange stick. It's bigger than a toothpick, and it has a slanted edge on it where you can actually get up underneath the fingernails and clean those real good. Sometimes on the little fingernail clippers itself, on the back end of it, there's an arm that you can bring out, and it has a little hook on the end of it. That allows you to clean up underneath the fingernails as well. The cuticle is the bottom part of the nail where the skin is. You can actually push that back just a little bit because it tends to attach to the nail and it'll actually grow up forward. You don't want to push it back hard enough that you're going to cause the patient to bleed. Only what's covering the nail. You don't want to go any further than that back into their skin. So we've cleansed the nail, we've cleansed under the nail. We take our towel and we're going to dry the hands very well. In between the fingers, when we're doing the feet, in between the toes. If we're going to be filing the nails, when we file them, you want to file them to the point where you still see just a little bit of white. You don't want to get all the way down to where it's pink. It says here that you file them straight across. Most patients don't file theirs straight across. Some ladies like their fingernails filed straight across, and that's fine. Ask them. It's just a personal preference. You want to let a little bit of white show. Don't leave any rough edges. If you leave rough edges, as you know, you could snag it on something, and it could cause a hangnail, or it could pull back away from the skin, and then it's extremely painful, and it can get infected later on down the road because it would be considered an open area. And last, you would apply lotion to the skin. The important thing is you can apply the lotion to the hands. You can apply it to the top, bottom of the feet, also to the heel of the foot, but never, ever, ever put lotion in between someone's toes. It will stay too moist. The skin will break down because of the excessive moisture. They'll get sores in between there. They'll also get fungus infections in between there, where they get real red, real irritated, they start draining. There'll be some white patches. That's something that we need to avoid. And that's good nail care. Okay, the next 4 areas we're going to talk about, we actually don't need a guinea pig for these ones. 5B, 5C, 6, and 7A. The skin care is important. It covers from the head to the toes of a patient's body. Our objective is to provide skin care to the areas that are prone to redness, discoloration, and skin breakdown. And those, we're looking at the pressure points. The back of the head for a patient that's in bed. The back of the head, the shoulder blades, the tailbone, the elbows, the ear, because if they're on their side, you're going to get a lot of pressure there. The heels, and the tips of the toes. The tips of the toes, because if there's too many heavy blankets or covers on the patient, I've seen bed sores on the tips of their big toes because of the pressure that's coming down on top of it. Okay, our behaviors 1 through 5. Number 1, you're going to inspect the skin for redness, discoloration, and evidence of beginning skin breakdown. Observe areas that remain red after repositioning, and the time frame on that is 10 minutes. Anything more than 10 minutes, there's a problem. That redness should be gone. If you go in and they're on their right hip and you roll them over onto their left, that right hip's going to stay red for a little bit of time. That's normal. It's not normal for it to stay red longer than 10 minutes. The important thing here is the word inspects. You are the eyes, you are the ears of the other medical professionals that are involved in that patient's care. You will see something. You're going to spend the most time with this person. You're going to see something before the doctor sees it, before the registered nurse sees it. Very important. So when you inspect the skin, you want to look in the skin folds. You want to look in between the fingers, in between the toes, under the arms, along their back. Look for those bony areas. Make sure that they're not soft and mushy, especially the heels. Number 2, you're going to wash the skin as needed, including but not limited to the back, hips, sacrum, and other bony areas. We do that. That's good skin care. That's part of the bath, and we already went over the bath. Number 3, gently applies and does not massage lotion to pressure areas, including but not limited to the sacrum, which is the tailbone, their back, their hips, and other bony areas. And the key there is don't massage those bony areas. When you massage those bony areas, you're actually causing some more damage. You can apply it gently. You can rub it on. You want to keep rubbing it. And you know how when you first put it on, it's kind of thick and it's kind of greasy. But as you keep rubbing it gently, it starts to get absorbed into the skin. And then it starts to get a little friction there when you're starting to rub it. That's how you know the lotion got absorbed into the skin well. Number 4, before I do that, it's important that when you apply lotion of any kind to a patient, that you squirt it into your hand and that you rub it first. That warms it up. Anybody ever just take lotion and squirt it on your back? Yeah, it's cold. Okay? You don't ever want to do that. You want to squirt it onto your hand, rub it on your hands, get it warm, and then apply it. You don't have to wear gloves to apply lotion either. I do, because I don't like that feeling on my hands underneath when I'm trying to work. And some of the lotions, I don't like the smell. So if you don't like the smell, you can go ahead and put gloves on. You can apply it with your gloves on. You take them off, your hands are fine. You don't have that smell all day long with you. Number 4, smooths clothes and or bed linen under the client to avoid bunching and wrinkling and allows for free movement. This is